Good evening, everyone. This is Rina Barai, board member for the NPA. Welcome to the NPA's webinar this evening on business continuity all around COVID-19. Firstly, I'd like to sincerely apologise for the late start of this webinar. I can't blame coronavirus, actually, but we've had a few technical faults, so I really am very sorry, and thank you to those of you who are still hanging on. I really do appreciate that. First of all, I'd like to say to all of you, kudos to you to actually just joining this webinar, because like me, I'm sure you are absolutely shattered. It has been another absolutely crazy day in our pharmacies. Whether you're working in your pharmacies or you're managing a chain of them, we are in unprecedented times, and you've heard that said so many times. But literally our worlds have suddenly been turned upside down by this. And already, day to day, it's been hard enough to do our day jobs in the recent months and years. And now with this on top of it, I'm sure like me, we're all struggling. And I think we're struggling with the pace of information, the change of information that's coming through. We're all having to change our practice, and we're all wondering, is this right? Can we do this? What's right? What's wrong? What can I do? And I think the biggest thing that will be tested over the weeks, already has been tested and will continue to be tested over the weeks and months, is our business continuity. Hopefully this webinar is going to answer some of your questions towards that. And I'm very privileged to have a whole panel of our NPA colleagues on the webinar with me, and I'll leave them to all introduce themselves. But these are our colleagues who are working really, really hard and tirelessly to try, get our heads around this. We've never had anything like this before in our sort of history. We had swine flu, all those years ago, but this is so much bigger. And all these colleagues of mine are working really, really hard to make sure we get this right for our members. So today a big part of the webinar will be making sure that you're asking us questions. We will try to respond to all of those questions. We'll have a Q&A at the end of this webinar as well. But obviously if there are any burning questions, or if you're listening to this on a pre-recorded playback, please do email us with any questions that you have. We are compiling, a list of the questions, a list of the problems currently that we're facing, and we're trying to find solutions for all of these to support you in these testing times. So what we'll be covering today in our webinar is the NPA's response to the coronavirus outbreak. We're going to talk about some of the issues that some of us are facing around managing staff absences, and how are we going to manage capacity-wise if we get more and more people absent due to self-isolation or due to having the symptoms themselves, and this is a real worry for all of us. We'll also be having colleagues from the NPA insurance arm, and obviously loads of you will have questions about what's covered, what isn't covered, and so they'll be supporting you with questions that you post to them. And just like I said, right at the end we'll have our Q&A session. So please do feed in those questions. There's a functionality on the webinar for you to post your questions. So please do keep them coming throughout the webinar. I'll be doing my best to respond to those as my colleagues present to you now. So now I'd like to hand over to my colleagues to continue the webinar.
Thank you, Rina. Okay, we're still just waiting for Gareth and Helga to reconnect. We do have a couple of videos to share with you, first of all. First of all, we're going to share a video from one of our partners, Ellis Whittam, which is an extract from a webinar that they've recently done, and that's all around advice around employment law and HR. So I will launch that video now for you, and we will be back with you following the video.
As you can imagine, we've seen a significant upturn in inquiries over the last few days in relation to the virus and the impact it can have on the employment relationship. What we've done here is pull together some of the most common scenarios we are being asked about and have provided advice on how to deal with each particular one. Your employee is too sick to attend work because they have contracted the coronavirus. So in those circumstances, your usual sickness absence policy and procedure applies, including sick pay where relevant. Obviously, you'd expect absence to be recorded using the usual procedures, but you should also assess the risk that the employees passed on the virus to colleagues and take appropriate steps in that regard. You could consider contacting Public Health England for further guidance. Your employee is not sick but cannot attend work as they need to take care of a sick relative or because a school has closed. So in those circumstances, employees are permitted unpaid emergency time off to arrange care for dependents. It's important to note that this is the time off to arrange care that's permissible, not to take care itself. So this is usually limited to quite a short time, probably 24 or 48 hours, although this will depend on circumstances. If more than those 2 days' absence are required, and the reason for being off is to care for the child or relative rather than to make arrangements for their care, you'll need to agree alternative arrangements with that particular employee. They could include taking annual leave, working from home if feasible considering the job type and whatever caring responsibilities they have, or perhaps a period of unpaid leave. Your employee is not sick but refuses to come to work because of the risk of infection. In the first instance, I'd suggest speaking directly with the employee to understand their concerns. If the employee is still refusing to attend, you could allow them to take annual leave. They could work from home if that's feasible, or you could allow a period of unpaid leave. You may also be able to insist on the employee attending work if their concerns are completely unfounded, but practically it will be difficult to get the employee to attend in those circumstances. You could give consideration as to whether this is a reasonable management instruction that the employee is failing to comply with, in which case disciplinary action could follow, although care should be taken with this, as taking disciplinary action in these circumstances may not be the best course of action considering these extreme circumstances. Your employee is not sick but cannot travel to work due to restrictions on travel or public transport. With this particular scenario, the employee is not presenting themselves as ready, willing and able to work, so there is no requirement on you as the employer to pay normal salary. If this was an issue, the employee could be allowed to take annual leave. They could also work from home if that's feasible, and in the absence of annual leave or working from home, you could grant them a period of unpaid leave. Your employee is not sick but has been advised to self-isolate by either a GP, a medical professional or via the NHS 111 helpline. In those circumstances, the position now is that that employee would be off on sick leave and your usual sickness absence policy and procedures will apply, including sick pay, either SSP or contractual where relevant. As normal, absence must be recorded using the usual procedures. Your employee is not sick but has self-isolated due to government guidance, for example because they have just returned from a high-risk area. In those circumstances, the position now is that that employee would be off on sick leave and your usual sickness absence policy and procedures will apply, including sick pay, either SSP or contractual where relevant. As normal, absence must be recorded using the usual procedures. What are the current rules around statutory sick pay? In the normal course of events, statutory sick pay or SSP is only paid from the 4th day of absence. However, the government announced recently that the requirement for those 3 waiting days would be scrapped. In addition, as part of his budget, the Chancellor also confirmed that sick pay will be available for employees who are advised to self-isolate due to the coronavirus, even if they are not displaying any symptoms. Further, also as part of his budget, the Chancellor confirmed that the government will reimburse small employers, i.e. those with less than 250 employees, any statutory sick pay they pay to their employees for the first 14 days of sickness. However, as of the 11th of March, we still have no details as to when these new rules will be introduced, so they are not in force yet, and SSP waiting days are still currently required. For information, the current rate of SSP is £94.25 per week for anyone earning over £118 per week. That rate will increase to £95.85 from the 6th of April 2020. Your employee is not sick, but you require them to stay away from work for 2 weeks as a precautionary measure. This is a slightly different situation, and as it is the employer that has made the decision not to allow the employee to work, the employee will be entitled to full pay unless one of the following circumstances apply. Firstly, the employer should check whether it has the contractual right to lay off the employee without pay in these circumstances. That will vary from employer to employer, and each contract should be checked individually to make sure there is a layoff clause that covers this. In addition, the employee could be instructed to work from home if that is feasible. You could ask your employee to take annual leave, but some may not agree in these particular circumstances. You should also note that even if the employee does not agree to take annual leave, you can force them to take holidays from the 8th day of absence by serving notice to take holidays on the first day of their absence. Thank you for watching. I hope you found this webinar informative, and if you have any further questions about this or any employment law or health and safety issue, then please do make contact with us in the usual way.
Gareth Jones here from the MPA, and I'm now going to run through a summary of a few of the things that the MPA has done in the last few weeks to help members deal with this current situation and raise concerns and issues to government. We know our members are at the front line of what's happening at the moment, and have never been faced such acute challenges at the moment. So you can see my slide that some of our risk activities. So we are in daily contact with NHS, Department of Health, GPHC and the PSNI, the MHRA and other pharmacy bodies to raise member concerns of all the issues that are coming up to us. Specifically, we've made clear to government that urgent funding is needed in community pharmacy. We've made a statement to the public, which we made with the CCA on Sunday, Monday, asking patients not to come to the pharmacy if they have symptoms and only request the medicines they need now for their family. That's been picked up in the press this week. We've established an information hub and updated that with information for members for advice that we've generated, also government guidance. So that's on the MPA website, accessible easily from the front page. So I'd certainly recommend viewing that. We've also put out some comments about MPA insurance. Obviously, there's a lot of concerns in that area at the moment. People wanted to know if they're doing something different, whether that's going to be covered, and whether they're going to be covered in the case of forced closure. And we have a video from the MPA insurance from Paul Coleman that's going to cover in a few minutes to cover that particular topic. And we've been talking to DH and the NHS, answering some of their queries about indemnity issues as well. We've circulated posts to members and had an unprecedented amount of media activity, particularly in the last week, covering a number of areas. Certainly, we've been talking about the way people should be using pharmacies at this particular time, and that was picked up on ITV News on Monday evening. Been using this opportunity to highlight the heroic contribution that community pharmacy is making, and just reminding people that in a crisis, what people really need more than anything else to carry on is food and medicines, and that just highlights the vital role that we play. But also, and this is something that's been happening the last day or so as well, defending the sector's reputation in response to accusations of price gouging, which has come up particularly today. But we are responding robustly to that, those suggestions in the media again this evening. I was just going to summarise some of the issues that we are actively raising for members at the moment. And I want to stress so much is happening at this time. We are raising new issues every few hours, and part of the reason that we wanted to have this webinar this evening was to provide another opportunity, I think, to pick up any issues from members that we can helpfully escalate at a national level. And we're working closely with other national pharmacy bodies, developing a coordinated list of issues to streamline the process and discussions with government to ensure that we can get all these matters considered. But number one, contingency funding for pharmacies that are forced to close temporarily. We're also seeking emergency cash flow scheme to deal with cash flow problems. Changes to ease the burden of regulations, such as potentially greater use of original pack dispensing, easing of non-time dependent requirements of the contract. And some of these things have already been picked up, and there have been announcements from PSNC and NHS England recently on that. Flexibility on pharmacy opening times is an important one that members have asked us to ask for, and so that we're raising that. Recognising pharmacy staff as key workers, so that's very much a live issue after the announcements yesterday about schools. Also been arguing for easing prescribing restrictions, for example, in relation to branded generics, and also protection for pharmacy staff, for example, physical barriers. That really is just a flavour. There are dozens and dozens of things that we have on our list or are coming in this evening, and obviously we expect to pick up more from the questions that we are being asked, and we will raise those tomorrow and in the days to come. So I'm now going to, I think, hand over to a video from Paul Coleman from MPA Insurance, who's going to talk a little bit about the insurance issues and hopefully provide some reassurance.
Hello, I'm Paul Coleman. I'm the Managing Director of MPA Insurance, based here in Mallinson House. Thanks for clicking on this video. We just wanted to take this opportunity to back up some earlier communications around business interruption, or commonly known as loss of profits cover, in the event of an unenforced closure of your pharmacy due to COVID-19. There's been considerable publicity around the fact that the vast majority of insurance policies do not cover this risk. But we can reassure you that our wordings, mainly via the pharma cover policy that most of you will have, will respond in those cases where the relevant authority enforces a closure of your premises. In addition, should the circumstances apply, we have on standby a network of specialist deep cleaners to assist in maintaining your essential services. The general advice, particularly if your pharmacy is not insured with MPAI, is to contact the broker who arranged your cover or your insurer for clarification on your position. For more information from MPAI, we shall continue contributing up-to-date bulletins and via the website, and the various insurance departments are also available by phone and email. MPAI has recently invested in beefing up internal capability and systems, and this is greatly aiding our ability to provide a flexible service through this crisis. Like all of us, in our personal and professional lives, MPAI is having to adjust to a new reality. But you can be assured our primary focus remains that of ensuring our member policyholders receive the support necessary for them to continue their vital work for the community. Thanks again for watching.
Okay, that was Paul Coleman from MPA Insurance. We do have a number of MPA staff online to answer questions that you're putting into the question box, but also who can answer questions over the phone line a little bit later on. So if you do have insurance questions, we should have been from insurance available to take them a little bit later. So I'm now going to introduce my colleague Helga Mannion, who's the MPA Policy Manager. So she's going to run through a few of the few FAQs, the questions that we've picked up from members over the last week, and where we've actually been able to put out a position or a view This is I suppose just the start. We've got a lot of the questions we're trying to deal with at the moment, and we'll put up confirmed answers on when we can give them. Obviously, we're talking to the GPHC, NHRA, NHS, as well as taking our own internal advice on these questions. And they will be appearing on the coronavirus section of the MPA website. We'll be building a fairly comprehensive database of questions. But I'm going to hand over to Helga now, who will go through a few of the ones that have come up in the last few days.
Hello, thank you, Gareth. Good evening, ladies and gentlemen. So as Gareth highlighted earlier, we do have regular conversations with primarily the GPHC, the Department of Health and Social Care, and more recently now with NHS England. On top of that, we also have the privilege of having some very ad hoc conversations with individuals, so we're able to speak also on an informal and a formal basis, sharing all of the concerns that are coming into our pharmacy. I'm just now going to, yes. So if you look on the screen, the first one that we've started to talk about is around the dispensing medicines in monitored dosage system. We have had queries and concerns coming from members into how we're going to address this, given that it's a very time-consuming process. We have raised this with the GPHC, and with everything else, there's something around risk assessment, applying the Equality Act versus, who workflow, that's what you have. We have been told by the GPHC that further guidance is going to come out, but it's always, as with such circumstances, where pragmatic decisions need to be made, and assurances will need to be made that you have made the decision and the reason why you have actually made it. We've also had queries regarding the use of ibuprofen in suspected or known cases of coronavirus. We have recognized, we understand, and recently we've had the CAS update from NHS England, that there is currently no strong evidence that ibuprofen can make coronavirus worse. We're already also wanting to make sure with our patients that they've already taken ibuprofen or another non-steroidal anti-inflammatory on the advice of a doctor. They are not to stop taking it without checking it first. We will be getting information immediately as soon as it's launched for our research, and as soon as we get that information, we will be populating that directly onto our website, tweeting about it, so everybody is alert as to the new guidance that has come out. As with something like this, not enough research is just coming out on a daily basis. We've also had conversations with the GPHC about issues around the supervision, and we've also had issues GPHC around our pre-registration students. So what we know thus far is that a joint statement was published yesterday, in fact, with the PSNI, that tells us that while the regulatory standards are flexible, pharmacies must continue to act within the professional competence, but they do give us some guidance into handing out prescriptions once they have been checked in the absence of a pharmacist. And if I could refer you and invite you to read the guidance, there's some specifics around it, which could be that the pharmacist could either be on the telephone or within some specific distance or whatever reasons. As with everything, it's around justifying the needs of the patient and the desire of needing to do it at that point in time. We also know that later on this evening, maybe it's already come out, the GPHC is also going to be issuing further guidance around professionalism, and this is particularly in light of some complaints that the GPHC has been receiving in terms of price gouging, and also with regard to some behaviours of locums who are cancelling on the day and then inflating their cost and charges, etc., to the contractors. So watch out for that information. As soon as we get it again, we'll just upload it onto the website. From the very beginning, we've obviously talked a lot about key considerations around delivering medicines. We do know that that is being considered very, very seriously by NHS England and the Department of Health Social Care. They recognise that not only is it an essential service, it's also key to supporting those people in isolation, in not able to get out and about, people who are not independent, the people who are actually dependent on perhaps that delivery for that social interaction. So this is just a bit of a headlines on what we've done. I'll just now hand over to Gareth.
Thank you, Helga.
I'm sorry. I beg your pardon. Sorry, I apologise. I hadn't finished the presentation. Would you like me to continue? Sorry, ladies.
Yes, please do.
I apologise. My screen was too small. I forgot to finish. I apologise. So another thing that we've also been looking is around professional indemnity insurance cover and using volunteers to deliver medicine. We have been told the following, as you can see on your slide, where your professional indemnity insurance will cover volunteers to deliver urgent medication. However, if your volunteers intend on using their own vehicles, they'll need to check that they're insured for business use. Otherwise, they'll not be covered as a result of road traffic accidents. It also would be prudent to look at your delivery standard operating procedures and amend as appropriate. Another key question that kept coming up is around the repackage of paracetamol. So on two of these points, the Department of Health Social Care is fully aware of the supply issues, and we have been assured that conversations and talks are taking place with a view of applying much of the Brexit contingencies that we have in place already. We feel that this is not quite ready, but we keep going on about it on a regular basis. However, helpfully, today, the GPHC has issued a position, as stated here on your slide, where pharmacies may break down larger packs of paracetamol to prepare smaller packs for people and the public who need them. And it's something that, again, we need to ensure that we apply the appropriate labelling and safety information in a clear and understandable way. And then we also have a reference to the standards. We've also been assured by the GPHC that inspections are no longer taking place. However, inspectors are on hand to provide support either on the telephone, and in some cases we understand these inspectors have rolled up their sleeves and actually supported the pharmacist at the coalface. As I already mentioned, we will continue to provide these updates through the MPA website and any subsequent webinars that we will have. So please continue to share your concerns, your thoughts, and we'll continue feeding them up the chain. Thank you. Apologies, guys, and now I can hand over to you.
Sorry, this is Gareth here. I'm hopefully going to be able to pass over to my colleague Janice now, just to say a few words. So Janice is our Scottish manager. Janice, are you on the line?
Yes, I am. Can you hear me? Sorry.
Yes, we can, Janice. Yes, we can, very clearly. So, yeah, please go ahead.
Yeah, so I'm Janice Ullman. I'm Scotland Representation Manager for the NPA. And it is about reassurance that the NPA is listening to members from across the UK, and we're hearing from lots of members what they're experiencing, what they're needing. Now, the COVID page in the NPA website is getting updated for all the Scottish resources that are coming through from Health Protection Scotland. There's a letter from our Chief Pharmaceutical Officer, but very much it's very similar. Everything's coming through from UK and then going to Scottish Government. We're in regular contact with Community Pharmacy Scotland and responding to any of their queries as quickly as we can. I would like to highlight two resources that are available. One is from Health Protection Scotland, and that's advice for pharmacies, and that really gives close detail on how Scottish Government are picking up that it's getting impacted in the pharmacies. And there's also advice for primary care, and that includes the Scottish Government regulations on the deep cleaning that is required. So 2 separate pieces of information, but anything that comes through for Scotland will be on that NPA webpage, and the NPA can be contacted through the general numbers for any queries from any of the members from any of the other countries other than England. And there's a representation manager within each of the countries other than England that is very closely contacted with the organisations there. I think in Scotland there's a couple of things that we have, and they're both identified by the Chief Pharmaceutical Officer in her recent letter to the network, in that minor ailment service is a huge benefit to be able to provide NHS medicines to patients that are required, and I think shortly there will be changes to that service very quickly before the Pharmacy First comes through. And also the unscheduled care. The unscheduled care, NHS patient care direction really enables us to sort out patients really looking for medicines without prescription, can't access a GP with their normal full month supply. So there is an urgency to use these facilities that we have. There's a huge increase already with it, and recommendation to use those services from the Chief Pharmaceutical Officer in Scotland. Thank you.
Thank you, Janice. We are hoping to have Anna Callister from Northern Ireland on the call as well. I'll just see if Anne's available. So I think possibly not quite yet, but okay, I'll pass that then to Rena, and I think Rena, you're going to highlight some of the questions that have come through, and we'll see if we can address some of those questions now. So over to you, Rena.
Hi everyone, thanks for the presentations. Thank you for all your questions too. We are inundated with questions, and I don't think we're going to have enough time to go through all of these, but we do promise to respond to you. Many of us are responding to individually as well. I think the biggest question, and the one that's on everyone's lips, is what is the MPA doing to try and ensure that pharmacies are being recognised and reimbursed accordingly for their extra work? And I'd like to hand over to Gareth for this answer, because there's been a lot of work being done behind the scenes and in collaboration with the other pharmacy bodies like the PSNC, RPS, CCA, just to make sure that we do get recognised for this hard work that we're doing.
Yes, Rena. I think we are in contact with PSNC and the NHS across the UK, highlighting everything that we're getting from members every day. So we are picking up through hundreds of phone calls and emails every day a lot of what's going on, and we are in all those calls making the case for a number of things, which is obviously sustainable funding in the long term, as we've been asking for a long time. But I think now that pharmacy has been called on in a crisis, I think it makes the case even stronger. Again, we're asking for contingency funding for people who need it because they're forced to close. We're asking for cash flow support. So at the moment, I mean, the thing that I can say is, immediately announced already, but please rest assured, we know how hard it is for the MPA members, and the MPA board convened on Monday afternoon as a teleconference to talk about their great concerns at the moment. So we entirely know how difficult it is on the ground, and how the challenges that people had before have increased so drastically in recent times. Helga, have you got anything to add?
No, I think it's very comprehensive. Thank you, Gareth.
Thank you, Gareth. And the next theme of questions that are coming through are all about pharmacy deliveries, and I am sure, like me, you are inundated with requests for pharmacy deliveries, just your usual deliveries, and then patients who are now self-isolating, be that with symptoms or because of medical conditions. So some of the questions that we've been asked are, has the MPA got a standard operating procedure for medicine delivery service? And of course the answer is yes. Please do look at our website and look under the standard operating procedures, because we do have a standard operating procedure. We are in the process of trying to look at this in light of coronavirus again, because we recognise that actually we will have a lot more deliveries to do and potentially be taking on new staff at short notice to do these deliveries. So we need to make sure that the people who we are recruiting to help us with these deliveries are fully trained and following the due processes that are necessary when delivering. So please do look out for that on the website. We're also being asked about, will there be any funding for deliveries? And I'm going to pass that question on to Gareth, if I may.
Yes, there's certainly discussions underway on that one. Again, across the UK, that case is being made. I don't think we have an announcement yet, but we'll let members know as soon as there's a resolution there. But I mean, the case is being made very strongly that a delivery service is not something that is provided in the contract. It's absolutely key that that's available for a lot of people over the next few months, and it can't simply come out of existing funding to pharmacy. That's utterly impossible and unacceptable. So, yeah, the negotiators are all making the case and talking about how any sort of service can be properly funded.
Thank you, Gareth. The next question we've been asked is about re-registration of potentially retired pharmacists or those who have lapsed from practice. And I know with all of us possibly facing major shortages of staff over the coming weeks and months, this is a real concern, and obviously a group of people that we'd love to be able to tap into. Can I ask Helga to respond on that question, please?
Thank you, Rena. In fact, we are going to be expecting some guidance imminently, where the GPHC is working very closely with the GMC and the equivalent of the Nursing Council to look into how to bring back the criteria required for those retired on good standing pharmacists and pharmacy technicians. I understand that they'll be looking at those people who have retired within the last 3 years in the first instance. I do know that this is quite live and that they will be, as I said, very imminently we're expecting some further guidance about it. As you're talking about workforce, I wonder if I may also add the question around pre-registration pharmacists. So on 2 levels, this also is quite live with the GPHC. Firstly, with the current pre-registration trainees and their training and disruption that they might have, not only as a result of the crisis that we're going through, but also to the fact that if they need to self-isolate, they may go over the regulatory absence. So the GPHC is fully aware of that. Again, they will not be holding it against the student. They are aware of all this disruption that is doing to the current pre-registration trainees and want to assure them that, you know, we just need to carry on as we are, but everybody is fully aware of the whole situation. And this would include as to when and where the registration assessment will take place. We also, as I said, guidance and further information will follow, noting we are still in March. The exam is due in June, but information and, you know, regular contacts will be made with the students. There has been some consideration and some debate as to whether these pre-registration students would be able to step up, which is what the doctors are asking for 5th and 4th year medical students. This will not be the case with pre-registration students. I repeat, pre-registration students will not be able to step up in this time to be working as pharmacists. I just thought I'd just preempt some of those questions. Thank you, Rena.
And actually, Helga, sorry, Rena, if I could just add to Helga's initial answer, we've had discussions with the Department of Health about retired pharmacists earlier in the week, actually, and about ensuring that they are insured. And, you know, we were able to confirm that there wouldn't anticipate any major problem there. If somebody is working for a member pharmacy, then our cover will apply.
Also, I'd like to add, Janice has just informed us that NES has also issued some new resource for pharmacists who are new or returned to community pharmacy during the COVID-19 outbreak. So in Scotland, Nest Training has just issued some refreshers. We will continue to find out whether this will be the case in England and Wales. We know we have Anne on the line, so we're not sure if she's got any further information with regard to Northern Ireland. But we will keep you posted, as always, through the COVID-19 MPA webpage.
The next sort of theme of questions around safety and, how do we make sure our staff are safe? Have there been any pharmacists that have fallen ill in countries like Italy, for example, where the crisis is at its peak? And is there any availability of testing for COVID for our frontline staff? I would like to give that question to Gareth, if I may. Thank you.
If you don't mind, I'll pass it over to Helga, actually, to kick us off on that one.
Thank you, Gareth. So we have made a case on behalf of our MPA members that all frontline staff should be considered just like NHS staff and prioritised in as much as COVID-19 testing. This has been taken or is being taken currently into consideration and is being explored and discussed further. With regards to what's going on in Italy, so we're quite lucky as the MPA because we sit around the table with all the other Europeans and we're able to dialogue and speak to our Italian cousins as well as other countries that are now becoming to be affected, such as Spain and so forth. I haven't asked the question as to how many pharmacists have been affected by this, but I will certainly ask and trying to get an idea. But I guess with everything, that is why we're putting contingencies into place, because of course we are all at risk. But that said, we again had a reaffirmation today from the DHSC, from NHS England, that NHS 111 and equivalent in the devolved nations have now got a secondary fail-safe guarding question to ensure that people with symptoms do not enter the pharmacy. So at the very beginning, some 4 or 5 weeks ago, when this pandemic started, if you like, we did have instances where we felt that there were members of the public who were coming into the pharmacy with symptoms or they had just arrived from a traveling country. We have been assured by NHS 111 that this was not the case, but again, after complaining vigorously, we now understand that the pathway has been reviewed such that the patient is asked no less than twice to confirm as to whether or not they have any of the symptoms or signs relating to COVID-19. On that basis, we have been assured that nobody with the symptoms or even who is self-isolating or with the new regulations, as in household, if you like, with 14 days, we've been assured that you will not see these people within the pharmacy. As we have done before, again, if you feel that this is not the case, please just share it with us. But we were given this assurance no later than this afternoon by the various individuals. So to reiterate, no less than twice are people being asked this question, regardless whether they go online or they telephone NHS 111.
Thank you for the answer to that question. I'm going to ask two more questions, theming the questions that are coming through, and I'm really very grateful again for all these questions that are coming through. If we've got Laura on the line from Ellis Whittam, we're getting a lot of questions about what is a key worker and about staff potentially wanting to self-isolate because they've got certain medical conditions or their partners have a medical condition. Really like some clarity on, what's right and wrong here, please. Thank you, Laura.
Yes, certainly. In terms of what we pay staff in that situation, whether we allow them that time, really we're pointing members at the moment to the almost up-to-date government guidance with regard to self-isolation. If somebody is following that guidance, it's required to self-isolate, for example, if they are coming to the high-risk category, then in theory they're off work and they're entitled to statutory sick pay. Now, one issue we have had is that the government guidance isn't wholly clear. It's a recommendation, a suggestion. But I suppose in the current climate, it's balancing, obviously, our commercial needs against ensuring that everyone is fit and well in the current climate. But as I say, if they're following the up-to-date government guidance, the legislation has been changed as of last week, whereby they will be entitled to statutory sick pay during that time.
Thank you, Laura. Janice, I was really pleased to hear Harry from Community Pharmacy Scotland give a message to the contractors in Scotland. And one of the things he said on there was, don't wait to ask for permission to do things. And I think as a profession, we are so used to being regulated and, we literally can't breathe without having an SOP in place in our pharmacies. And now we find ourselves in these really challenging times where we're asking ourselves, can we do this? Can we close, for example, for lunch? Do we have to ask for permission to change our contract hours? Should we be wearing masks? Are we allowed to operate a closed door policy? And loads of us pharmacists are sitting, in our pharmacies every day thinking, we just want somebody to give us the answer. Can you give us any guidance on what's happening in Scotland, for example? And is the approach really to be pragmatic and to do what's right for your business and your patients?
Harry McQuillan, Chief Executive of Community Pharmacy Scotland, which is the Scottish negotiating body, is doing a daily video out to the network of community pharmacies in Scotland. We are probably every day this week we've maybe been in touch with CPS over things. They've been contacting us as we have with them, with members' queries and issues, just to try and raise whatever is the most pressing issue with members. Some direction is coming through from boards as well, the NHS boards that cover Scotland. So they're trying to keep in top of what is needed and get those messages out to contractors too. So it's very important that people are watching their NHS mail account and they're getting the important updates from their board, and they're also keeping in touch with their board and watching nationally in Scotland from CPS. Most boards have put out a notice that they are accepting of the pharmacy being closed to the public, either 1 hour in the morning at the start of the day, or 1 hour at the end of the day, and 1 hour for lunchtime. And that's there for deep cleaning if it's required, to catch up in whatever tasks are the most pressing, to try and manage the public expectation of pharmacies through the rest of the days. So it's about maintaining the pharmacy hours and the pharmacy services that are there, that are going to make a difference to the patients, and also support the other health professionals that patients aren't getting access to at the moment. So there's definitely guidance here coming out from most boards about your hours, and there's a flexibility there. The regulation is obviously GB-wide, and I think that's given us some kind of guidance as in think as a health professional, think about the patient, and yes, you are a health professional that's registered to take your own responsibility, so take your own responsibility. There's lots of tools there that we mentioned earlier that can support you with that. Keep in touch with CPS, keep in touch with ourselves, and it's a case of pulling together what's happening. There was examples today of things that were really just unacceptable from other organisations that affect pharmacy to do with supplies and things, and very quickly that got fed back through a number of different channels, and hopefully it's getting sorted at the moment. So we need to hear what's happening on the ground. We need to hear the issues, and it is vital that we hear that and CPS hear that, and the conversations are directed to get the best support as quickly. Let's get as much as we can ironed out so we can get on with the business of helping patients.
Thank you, Janice. I'd now like to... sorry.
Sorry, Rena. Sorry, just to add to that, I just think it's worth quoting directly from the statement put out by GPHC and PSNI that we recognise that in highly challenging circumstances, professionals may need to depart from established procedures in order to care for patients.
I think that's a really good point. Yeah, and I think a lot of us are so worried about doing the wrong thing and then having the heavy hand come down on us. But I think everything you do needs to be in the best interest of your patients, of your team, and following national guidance if there is guidance available. So I think that would be my sort of top piece of advice to all of you. I wish we had answers to all of your questions. I really do, because these are questions I'm asking myself every day. But I promise that we will get back to you on all of these questions that you are asking. They're fantastic questions. Just finally, I wanted to bring in Glyn from NPA Insurance just to kind of give a quick summary of some of the questions that people are asking about, what's covered under our policy, what isn't covered, and especially in terms of business continuity, everyone's got concerns. What if our staff all are off sick and we literally can't open the pharmacy and we're going to lose out on our business? What's covered under our insurance?
Okay, thanks, Rena. Well, obviously, I've been listening to all that's being said, and obviously, those of you that know me, that my field, if you like, is on the professional indemnity side of things. And what I would say is that, yes, as professionals, as Janice and the other presenters have alluded to, you're facing, uncharted waters. You're going to have to exercise professional judgment, and do be reassured that MPA Insurance on the professional indemnity side will be behind you all the way. With very difficult issues, don't hesitate to sort of get in touch with us. We'll do our best to sort of help you through the practicalities. What I would add, assuming of course that you have time to do this, if you come across a difficult issue, just make a note, a little record, perhaps against a PMR or something like that if you need to, because if later on that's challenged, the circumstances in which you make that note, a contemporaneous note if you like, will help no end. And to be honest, I think all the regulators know that we're in very, very difficult times, and frankly, I don't think you're going to be pilloried later on for decisions that are taken, and often they'll be taken on the hoof in extreme circumstances. So we MPA Insurance will do all we can and stand behind you if we need to, if you like, the chips are down. The other question I think that you've alluded to is on the business interruption side of pharmacy having to close. Now, as I say, I'm going to make it clear to you all that this is not my bailiwick directly, but I do know that colleagues in the general insurance department are giving advice to individuals. My understanding is that the business interruption side of the policy, and I've got Mike Prevost with me, and he'll correct me if he thinks I'm wrong, is obviously subject to an instruction to close and deep clean the pharmacy being received from Public Health England, and that would then trigger that side of the cover. And then MPA will do the necessary to cover the costs of a deep clean. I won't go into the specific detail of the policies for obvious reasons, but I understand as well that on the Gov UK website there are guidance notes regarding cleaning and in some circumstances undertaking a deep clean yourselves if that's what's potentially needed. But all I can say is that as and when difficult issues arise, get in touch and we'll do all we can to help you out.
Thank you for that, Glyn. I'm very conscious that we started late, and I don't want to take up any more of your time. I will just give a quick summary of some of the questions that we have been asked, so that you know what answers that we will hopefully be getting back to you and all our members on. We've been asked things like, do we still need to do FMD? If I wanted to take on some temporary staff, what sort of training would they need? Do they need to be enrolled onto courses? Can we refuse deliveries if we don't have enough staff to deliver, for example? Taking in return medicines, things like that. Do we need to be cautious of COVID contamination on some of these medications? Some absolutely brilliant questions that you are asking us, and I wish I had another hour to go through all of these with you, because I want the answers to some of these questions too. But in the interest of time and in the interest of your sanity and your mental health and well-being, I am going to close this webinar, and thank you all very much for attending, and I will promise you that the team at the MPA who've taken part today will get back to you on all of these questions. I'd like to thank my MPA colleagues for all their input into this webinar, and again I'd like to apologise for the technical problems we've experienced today. This was beyond our control, and I hope that we've managed to pull off a webinar that's been useful to all of you. Thank you very much indeed. Good night, everyone.